form is called the heterogeneous formation product. Now, what does all that mean when we talk about dogs and cats and humans? We'll talk about how do you measure urine saturation. And in most instances, the solubility product usually is given a value of 1. And any value less than 1 is an undersaturated solution. You use this information every day. You just don't know it. For example, if you dissolve struvite stones medically by feeding a special diet, you induce a state of undersaturation. You push the state of urine saturation to less than 1, and the crystals in the stone dissolve back into solution. For most stone types, the urine is in a state of undersaturation. Struvite in dogs, ammonium urate, cysteine, other mineral types. And for stones to form, their concentrations, their activities exceed the formation product, the homogeneous formation product, that point all the way to the right. For calcium oxalate, though, dogs and cats are very similar to humans. Usually, urine from dogs and cats, adult dogs and cats, and adult humans are oversaturated with calcium oxalate. The number is above 1. And then it depends on what are other risk factors for stone formation. So one of the, we'll finish discussing is how do you estimate urinary saturation and how can we modify it to decrease the risk of stone formation? Keep in mind, supersaturation is a necessary prerequisite for stone formation, but it is not the only driving force for stones to form. And there is a large overlap between stone-forming patients, dog, cat, or human, and non-stone forming patients when you discuss the degree of supersaturation. So how do we estimate urinary saturation? Although you have seen literature describing using 2 techniques, which we will discuss, there are actually many ways to estimate the degree of urine saturation. And we should be somewhere close to back to being in the handout on this slide. So keep in mind there are lots of ways of estimating it. Likewise, usually these estimates are done by computer programs. And there are, in fact, several different computer programs that can be used to generate this data. The most commonly used one in human and actually veterinary medicine is Equal. And that is the computer program that most people use. There are others that use SuperSat, which is the one that's first listed. And actually in human medicine, there are other computer programs that are used. So we're going to talk about our 2 techniques for estimating urine saturation. The first is relative supersaturation, or RSS. Relative supersaturation is determined or estimated by collecting a urine sample, measuring a lot of compounds in it, and determining the activities of calcium and oxalate, for example, to then estimate the activity product of calcium oxalate, the mineral that would form a stone. It is then related to the solubility product for calcium oxalate. Remember, the solubility product is the point of saturation of a solution. Anything less than that number, the urine would be undersaturated, and anything above that number, the urine would be oversaturated or supersaturated. So the relative supersaturation is a determination of the activity product for calcium oxalate relative to the solubility product. That solubility product is actually determined not in urine, but in a simple solution. The technique is to collect a timed urine sample, usually 24 or 48 hours worth of urine. Then many things are measured. different amounts of calcium, oxalate, citrate, other ions. They are entered into the computer program which generates the information, the activity product, and the solubility, and then it's related to the solubility product to give us the relative supersaturation. In this system, as with many others, an RSS, a relative supersaturation of 1, is the solubility product, is saturated. Numbers less than 1 refer to degrees of undersaturation, where crystals would dissolve. New crystals will not form. Stones would dissolve. Stones will not form. A relative supersaturation greater than 1 then refers to a degree of supersaturation. The advantages of this technique is that it is fairly easy to do, although it is often hard to get a 24-hour urine sample from a cat, especially a client-owned cat. It is a good estimate of urine saturation, and it is influenced by urine volume, and we will come back to that. The disadvantages are that the number is related to the solubility product, and this is not determined in urine. Another disadvantage is that it does not take into account compounds that are not measured that may inhibit or promote crystal and stone formation. And as I've shown you, there are different computer programs and techniques for estimating this number, and so you do get different results. Now, if I take a urine sample and place crystals of the mineral that we're interested in. So for example, if I take a urine sample and place calcium oxalate crystals in, the crystals will try and achieve equilibration with the urine sample. And if the urine is at a state of saturation, then the crystals will neither grow nor dissolve. If we start with a urine sample that is supersaturated, then when we add crystals in, it allows precipitation, nucleation of those crystals, for example, calcium oxalate, on the crystals that we added. If the urine is undersaturated, then the seed crystals that we added will dissolve into solution. The technique that's used is something called activity product ratio, or APR. You collect a timed urine sample, you measure a lot of things in the urine sample, you take part of that urine sample and you incubate it with seed crystals of the mineral, the stone type that you're interested in, for example, calcium oxalate. You allow the sample and the new seed crystals to equilibrate, then you remeasure everything. What's done then is to take the activity product, for example, what's done is you take the activity product for calcium oxalate in the sample before incubation, and you divide it by the activity product for calcium oxalate after incubation. So it is a ratio of the activity products. The advantages are that you use the same urine sample from a patient for both sets of data. Therefore, it indirectly includes the influences of unmeasured inhibitors and promoters that may be present in the urine. It is not related to the solubility product, which in the relative supersaturation method is actually derived not from urine, but from a simple solution. It is also a very good measure of urine saturation. The disadvantages are that it is more difficult to perform. It requires purified crystals of somewhat equal size, shape, and consistency. And it assumes that the incubation of 48 hours is long enough for the crystals to either grow or dissolve. In these both techniques, usually some of the inhibitors that we measure include citrate and magnesium. Be aware, though, that there are lots of other compounds that inhibit or promote stone and crystal formation. We do not measure these when we do these techniques, but the activity product ratio indirectly takes these into account because we are adding seed crystals and then seeing if the crystals grow or dissolve. So how do stones form? After all of this, how do stones form? In simplest terms, one of two things happen. First, if the urine is in a state of undersaturation, below the solubility product, new crystals, new stones will not develop. And if stones or crystals are present in urine, and you lower the degree of saturation to this state of undersaturation, the crystals and stones will dissolve. That's what happens when you medically dissolve struvite stones, for example. You induce a state of undersaturation. For calcium oxalate, though, urine samples from adult dogs and cats, as in humans, is usually in this metastable zone, above the state of saturation, but new crystals, nucleation, does not occur. So for crystals and stones to form, one of two things must occur. Either the activities of calcium oxalate continue to increase so they exceed the homogeneous formation product, and you get spontaneous new crystal formation. That's what occurs with stones like ammonium urate and cysteine, but not calcium oxalate. The other thing that can occur is that formation product where heterogeneous nucleation occurs, where new crystals form on other crystals or other foreign material or proteins or cells. If that formation product is lowered, then stones and crystals will form, or a combination of the two. In fact, we've done some work with Bichons who are very prone to forming calcium oxalate stones, realizing they are not cats. But in looking at this breed that is prone to calcium oxalate formation, the way to determine that formation product for the heterogeneous formation product is to determine what's called the upper limit of metastability. Where is that transition from the urine struggling to hold minerals in solution to where minerals start precipitating around other things? The way it's done is to add increasing amounts of oxalate and find how much oxalate does it take to cause formation of calcium oxalate. In our limited studies so far to date, it takes much less in calcium oxalate stone forming dogs than it does in non-stone forming dogs. In other words, their upper limit of metastability is lower in stone forming dogs than in non-stone forming dogs. Now, the upper limit of metastability in both dogs and cats has been reported to be around 14. We have not done this work in cats yet, but in dogs, in Bichons who form stones, compared to Bichons that do not form calcium oxalate stones, their relative supersaturation is lower in the stone-forming dogs. And actually, that upper limit of metastability, that point of heterogeneous formation, is lower in the stone-forming Bichons than in the non-stone-forming Bichons. It's around a relative saturation of 9 in the stone formers, but around 25